Good afternoon, everyone, and thank you for joining us this afternoon at our media advisory for today. I'd like to welcome Michelle Baird, our Public Health Services COVID-19 Operations Chief, as well as Jason Thorne, our Emergency Operations Center Director, and returning contestants Melissa Farrell, President of St. Joseph's Healthcare Hamilton, and Rob MacIsaac, President and CEO of Hamilton Health Sciences. As you know, our public health team and community partners remain focused on increasing first and second and third doses of COVID-19 vaccines. And it remains a significant community effort to protect and make progress as we continue to open businesses and recreation centers. So I'd like to recognize Hamiltonians and businesses who are champions and leaders in demonstrating community care by ensuring they are doing their part by following and upholding public health guidelines in their establishments. This creates an environment that is safe as possible for residents, but also for their employees. So we must all continue to follow the well-established public health measures, including wearing a tight-fitting mask properly, maintaining a physical distance, limiting contacts and size of social gatherings, and staying home when you're not well. And lastly, there are ample appointments available and walk-in opportunities at special locations across the city for boosters, first and second doses, and pediatric vaccines. So check the hamilton.ca/get-your-vaccine website to know and understand the locations where they're available and the hours of operations for each. As well, they're now providing in-school vaccinations opportunities as well that I know Michelle Baird will share with us. So I will turn it over to Michelle Baird, our Public Health Services COVID-19 Operations Chief. Michelle.
Thank you, Mr. Mayor. So good afternoon. We continue to monitor key health indicators closely to identify when Hamilton has reached a peak or plateau in the surge of cases related to the highly transmissible Omicron variant. Currently, we are seeing some signs that this is occurring, including a decrease in percent positivity of those being tested, and we're seeing some preliminary decreases being seen in the number of new hospitalizations and ICU admissions for COVID-19 reported each day to Hamilton. With testing eligibility prioritized for vulnerable populations and workers, as well as their households, we continue to focus predominantly on key health indicators of disease severity, including percent positivity, hospitalizations, ICU admissions, and deaths, as well as the number and size of outbreaks in those highest risk settings. The average number of new daily hospitalizations and ICU admissions remains high, but early indications are that these are trending downward. Locally, there are almost 8 new hospital admissions each day on average and 1 new ICU admission each day. I know our hospital partners will speak to this data and the acute pressures that they are facing. The average number of deaths occurring per day remains high, averaging over the last 7 days at more than 1 per day. Hamilton reported its 500th fatality since the COVID-19 pandemic began. Our sincere condolences are extended to all those who have lost a family member or friend. Hamilton's rate of percent positivity is sitting at 14.6%, which is in line with the provincial rate. Hamilton's rate previously was 18.6% on January 25th and 22.7% on January 18th for PCR tests that have been completed. So it's certainly going in the right direction. Currently, there are 44 active outbreaks, with 4 new outbreaks being reported today and 10 outbreaks being declared over since Friday, February 4th. That's down from the 58 outbreaks we reported January 31st and the 80 that were reported on January 24th. As you know, effective December 23rd of the past year, we were focusing our outbreaks in the highest risk settings: hospitals, long-term care homes, supportive housing, the shelter system, and other settings serving Hamilton's most vulnerable. Details about the outbreaks continue to be posted on the COVID-19 dashboard. Though disease transmission in the community appears to be slowing, there continues to be a significant amount of strain being placed on our region's healthcare system and the frontline workers providing care. Again, I'm pleased to have our healthcare partners here with us today to speak to these challenges. With this strain top of mind, the Ontario Science Table modeling released last week showed the potential for hospitalizations to rebound following last Monday's reopening. With our community and the rest of Ontario gradually reopening over the coming weeks, it's as important as ever that residents take the necessary steps to prevent the spread of Omicron and reduce the pressure on our healthcare system. You can do this by getting fully vaccinated and getting a third dose of COVID-19 vaccine when you're eligible to do so. Data from the province continues to show that vaccination, including getting a third dose, provides strong protection against severe illness. Hamiltonians need to stay cautious and follow the well-established public health measures, including wearing a well-fitting mask, maintaining physical distancing, limiting your contacts and size of social gatherings, and staying home when you're unwell. This goes too for this Sunday's Super Bowl parties as well. Keep your indoor festivities to a maximum of 10 partygoers. On the vaccine front, overall, 86.8% of Hamiltonians 5 years of age and older have received a vaccine to date, and 82.3% are now fully vaccinated. 49.7% of children 5 to 11 years of age have received a first dose of COVID-19 vaccine, and 21.7% are fully vaccinated. For third doses, over 274,000 people have gotten their booster to date, or that's 63% of those that were eligible as of February 3rd. 3,650 eligible community members have received their fourth doses. Hamilton Public Health Services mobile vaccine clinics will continue to visit our local retirement homes this week and continue to finalize that rollout of the fourth doses in these settings. As the number of people remaining to be vaccinated becomes smaller and the community's management of COVID-19 continues to evolve, Hamilton's COVID-19 vaccine program is adapting and shifting to ensure protection is equally distributed across populations and the community. With a surge in demand for third doses in December and through most of January slowing, Hamilton Healthcare Partners are bringing more first, second, and third doses of COVID-19 to where people are. We're renewing our efforts and focusing on neighborhoods with lower coverage rates. With vaccine coverage estimates and other local data, long-term planning is underway with the Hamilton Healthcare Partners and other partner organizations, including local school boards, to support both the last mile strategy and the eventual transition of the COVID-19 vaccination program to a sustainable program model. As part of this ongoing shift, at the end of the day, on Sunday, February 13th, the Center on Barton COVID-19 Vaccine Clinic will wind down operations. In early January, the clinic was administering upwards of 2,700 vaccines per day. However, over the last week, the number of doses per day has dropped to 170 per day. We are grateful for the nearly 65,000 community members who have been vaccinated at this clinic since it started administering vaccines on November 18th, 2021. On behalf of Hamilton Healthcare Partners and all Hamiltonians, I also want to extend a heartfelt thank you to the many vaccinators and non-clinical staff of this clinic for their commitment in helping to increase protection for all of us. Going forward, the staff will be supporting school-based COVID-19 vaccine clinics and, of course, continuing at the Mountain Clinic at Lime Ridge Mall. In December, the expanded eligibility of third doses to 320,000 community members accounted for the most significant increase in eligibility we have seen to date in our COVID vaccine campaign. Local physicians, pharmacists, and non-clinical staff from a number of organizations have brought the best of our community to light. Collectively, Hamilton Healthcare Partners quickly scaled up vaccination efforts and expanded Hamilton's COVID-19 vaccine campaign in a concerted effort to sustain an extremely strained healthcare system for the benefit of all of us. During this period, vaccine doses administered increased from 2,500 doses to over 10,000 doses per day. The addition of several large-scale clinics, community-led clinics, primary care clinics, as well as the Ministry of Health GoVax bus and additional public health services mobile clinics assisted in the expansion during this period. Through the last mile strategy, there continues to be a wide variety of clinic options for Hamiltonians to conveniently get vaccinated. That includes, of course, the fixed site clinic at Lime Ridge, primary care-led clinics, school-based clinics, our neighborhood pharmacies, as well as our community partner-led clinics and the Ministry GoVax bus, and some pop-up clinics continue. All the information about clinics you can find at the www.hamilton.ca/getyourvaccine. Hamilton Public Health's top priority continues to be opportunistic and hyper-localized strategy to increase the administration of first, second, and third doses of COVID-19 vaccine. The strategy will ensure protection against COVID-19 is equally distributed across local populations, the community, and neighborhoods and school communities with lower vaccination rates. Residents will benefit from access to tailored information and vaccines that are accessible at convenient locations and times for them. When it comes to efforts to help balance the risks of the rapidly spreading Omicron variant and the risks of mental, emotional, and physical health of children, youth, and their learning, we are working in close collaboration with our local school boards to host school-based vaccine clinics and to promote the availability of walk-in clinics and other community clinics for children 5 years of age and over, either to receive their first or second dose of COVID-19 vaccine. We've been encouraged by the uptake of local school communities with nearly 500 COVID-19 vaccine doses administered at school-based clinics since January 28th. To provide even more choice and convenience for how their child or children can receive a COVID-19 vaccine, and consistent with provincial direction, access will be available for vaccination during instructional times in schools with parental caregiver consent, or after school instruction period, or on weekends, and then in those settings a parent or caregiver could attend. Public health nurses will be visiting local elementary schools during instructional time next week with a plan to provide a COVID-19 vaccine to those students aged 5 to 11 whose parents or caregivers have completed the consent form in advance and shared it back with their local school. Our aim is for public health nurses to visit all public and Catholic elementary schools by March break. We will continue building on this progress in the weeks ahead, working together with partners from across the community in an effort to increase protection and mitigate the highly transmissible Omicron variant and help to sustain an extremely strained healthcare system for the benefit of all of us. And on that note, I'm going to turn it over to Jason Thorne.
Thank you very much, Michelle. And I do have just a couple of quick updates and reminders for the public from the city's Emergency Operations Center related to the reopening of some of our city facilities, which began last week in response to the province doing their gradual easing of some of the public health measures that have been in place. So with respect to our arenas, they are open now to our leagues and to our permit holders with public health measures in place, including a 50% capacity limit. Our public drop-in programs have resumed at Harry Howell Arena, and we'll be gradually reintroducing those to our other facilities in the coming days and weeks. Our recreation centers are also open as of today at 50% capacity. Online registration for aquatic leadership programs is now open, and drop-in aquatic and gym programming also begins today, and reservations for those are available 24 hours prior to the start of each program. And our WaterFit programming will be resuming as of February the 21st. At our museums, Dunder National Historic Site, the Hamilton Military Museum, and the Hamilton Museum of Steam and Technology reopened as of February 1st last week. Our other museums will be remaining closed at this time to ensure that we're able to maintain the physical distancing and the capacity requirements, and also to, as we still continue to have some of our staff redeployed to support the vaccination effort. With respect to our other city services, the situation remains largely unchanged from what I've reported previously. Our transit is continuing to run on a modified schedule. We did reopen the McNabb Transit Terminal bathroom, public washrooms on Tuesday, February 1st last week. Our paramedic staffing remains relatively stable with full staffing available for most of our shifts. We currently have a total of 20 staff who are in COVID self-isolation, and these numbers have remained relatively static, with staff being cleared and others going back into isolation over the course of the week. In long-term care, approximately 1% of our staff between MacIsaac and Wentworth Lodges are off sick or isolating, and our staffing levels have remained stable thanks to the support of our casual team members, overtime work, and some of our redeployed staff. So with that update, I will hand things over to Rob MacIsaac.
Yeah, thank you, Jason, and good afternoon, everybody. I can be reasonably brief. The state of hospital care in Hamilton and surrounding region remains highly pressured. Last week, the government revised Directive Number 2 to allow for the resumption of some hospital services that have been paused. However, unfortunately, here in Hamilton, we are not in a position to ramp up in a significant way. Hamilton continues to be a relative hotspot for COVID in Ontario, and we are continuing to see an extraordinarily high demand for hospital care with acute funded capacity well over 110% on any given day at Hamilton Health Sciences. My colleague, Melissa Farrell, can speak to St. Joe's. Critical care availability in the region also remains strained. As a result, HNH-BB hospitals have a shared process to transfer patients out of region, and those decisions are always based on medical suitability. We are also seeing the effects of what we think will be a long and lasting COVID hangover, deferred care from the previous ramp downs, and people putting off seeking care because of the pandemic are straining local hospitals. The result of all of this is a less healthy population with more advanced illness. And looking ahead, this will mean more crowded EDs and hospitals for the foreseeable future. The pandemic has really shone a bright light on deficiencies in our healthcare system, deficiencies that existed in many respects long before the advent of COVID. The fact is, we need more beds, both in hospital and in community. Our hospital infrastructure is aging. Emergency departments and wards were not built for the patient volumes and infection control standards that are needed today. And we need more skilled people in our workforce. Given all of this, hospitals in Hamilton will proceed cautiously with ramp-up plans, although frankly, I cannot see ramping up happening in a significant way for at least a few weeks. We need to be confident that we can maintain access to urgent and emergent services. I'll reiterate some of Michelle Baird's excellent messages. We're asking our community to help us by following public health guidance and to seek care in the most appropriate setting when needed. We're asking people to get vaccinated. Vaccines continue to be a key weapon in our battle against the pandemic. And we have a long road ahead. So the impact of the pandemic on our communities and regions' population health is already evident and will be long lasting. By the numbers at Hamilton Health Sciences, 141 patients with COVID. Today, 46 were admitted because of their COVID. Another 95 were admitted for other reasons, but happened to be COVID-19 positive. We have 16 patients with COVID in our ICUs at Hamilton Health Sciences. In terms of occupancy, our ICU occupancy is over 90%, which is as good as it's been for quite some time, but also higher than we would like to see it, given the need to have some beds available for all of the other things that happen to people, like car accidents and strokes and heart attacks and so on. Overall, funded acute adult occupancy at HHS is around 110%, the Hamilton General at 107%, and the Juravinski is so strained at 126% of funded adult acute occupancy. With that, I will turn it over to my colleague, Melissa Farrell from St. Joseph's Hospital, Hamilton.
Thanks so much for that, Rob. I think there's a couple comments that I'd want to make that really complement some of what you've heard from Rob, and I'll give you the stats for St. Joe's. I think just starting off, really just highlighting the fact that, you know, we've been seeing some of the modeling coming out from the COVID science advisory table, and we're seeing some of the trends really show us that we've hit peak and we're moving through that. But I do think Rob's point that Hamilton and this surrounding region, Niagara included, really has been a bit of the epicenter when it comes to Omicron. And that means that although it's great to hear that we've passed the peak, we have to emphasize that we're still dealing with the capacity and staffing pressures And we still expect this to actually continue over the coming months. So I really wanted to just highlight that I feel very similarly to Rob when he was speaking about that. We continue to experience high demand for care for COVID and non-COVID patients. Our ICU capacity is incredibly limited, as he was just mentioning. We've been operating at or over 100% capacity on a regular basis. And at the moment, we're currently caring for 55 patients with active COVID in the hospital, and we have 11 out of 28 patients in our ICU that are COVID positive. Acuity is very high, and patients, the complexity of the patients is quite significant too, and that's including COVID and non-COVID. You know, COVID's an issue, but we're seeing, and we have other highly complex and medically acute patients as well. And the risk, as you can appreciate from an ICU perspective, is that if they're full, the care needs for new patients coming in through the emergency department who are critically ill and need life-saving care, or those who require surgical care needs for emergency services are in essence compromised because of that capacity issue or those capacity issues. I think it's also really important just to be emphasizing, and you didn't talk about this specifically, Rob, but I know this is a challenge at HHS too, is that hospitals really are the safety net in our healthcare system. And when patients are waiting for long-term care beds, or when they're requiring home care services, and if those home care services are not available, these patients wind up in hospital and stay in the hospital. And on average, we have 16 to 18% of our acute medical and surgical beds that are held by patients that are actually waiting for alternative levels of care in the community too. So that situation is also quite significant in the Hamilton region too at the moment. From a surgical and procedural ramp up perspective, feel exactly the same as Rob in terms of what he was just describing. We've actually been spending the last few weeks just trying to get our priority surgical and procedural care completed. Our priority really remains on essential and critical services at this point in time. Ramping up any further than that, I agree with Rob, is a few weeks away. I did want to stress how important it is for those of you who are at high risk of severe outcomes of COVID to get tested or connect with your family doctor, visit an urgent care center, connect in through our virtual urgent care doctors as soon as the symptoms of COVID hit. High-risk individuals are unvaccinated individuals 60 and over, unvaccinated First Nation Inuit Métis 50 years and over, or immunocompromised individuals 18 and over, really regardless of your vaccine status. And why I say this is that although the supply is limited, we do have access to antiviral treatments that can greatly reduce the chance of hospitalizations and even death for those who are immunocompromised or unvaccinated. And the key to accessing those treatments is to get tested within 1 or 2 days of symptom onset. You can visit the website that we all created together, hamiltoncovidtest.ca, to see if you're eligible for testing, but it is really critical to get in if you are in those high risk categories. And our monoclonal antibody clinic has treated over 300 patients to date, and less than 10 patients have required hospitalization. So it really is a success story if you can get in time to get access to those treatment options. I also want to support what the mayor and Rob and Michelle really stated when they were calling for everyone to continue to get vaccinated. The research does show us that vaccines help protect against serious outcomes that could put you in hospital and significantly reduces your chances of dying from COVID. This is especially true for those vulnerable populations that I was just describing. So that would be the update from St. Joe's, and I'm going to turn it back over to Mr. Mayor.
Thank you very much, Melissa and Rob and everyone else for the information and updates. And I know Hamiltonians will continue to remain thoughtful about all the public health measures in place that have led us to this point in managing this virus. And, you know, it's been a difficult and challenging journey, and the journey is not over, but I think we need to stick with it as much as humanly possible. And certainly most Hamiltonians are doing exactly that. So I appreciate that. And I'm going to turn it over now to Jasmine Graham to field any media questions that I'm sure will arise. Jasmine.
Great. Thank you, Mr. Mayor. We have 3 media joining us today. As usual, we will start with 1 question and 1 follow-up for everyone. First question goes to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much for taking my question today. And this one's for Michelle. And I'm just kind of following up on a long-term care story today. So when a home is in outbreak, we've heard from a lot of families all across Southern Ontario who've described just terrible isolation period of more than a month in their rooms, not being able to leave. How does Hamilton Public Health handle outbreaks in long-term care in this city? And are residents currently isolating and not allowed to leave their rooms in any of the 16 long-term care homes that are in outbreak right now?
Thanks for that question, Nicole. It's certainly one that's been bubbling around the community for a little bit. So with respect to outbreaks in long-term care, what we found with respect to Omicron is that we landed in a place where, so what's happened in outbreaks in past is that individuals who are contacts of cases or individuals who are cases, either or will use the isolation word, and they're in isolation for a period of, up until recently, it was 10 days. What's been happening though, and what's been resulting in these long isolation periods is they are in isolation for that 10-day period. At the end of 10 days, they come out of isolation, but then very shortly thereafter, or sometimes immediately thereafter, have another exposure. The incidence of Omicron is so high in our community, and we have so many healthcare workers that come in contact with it, that it's resulting in these exposures continuing. So individuals end up going back in isolation, which is so unfortunate. And we completely appreciate how difficult that is for the individuals involved, for the families, for staff working in these facilities. It's truly been challenging. New guidance from the ministry does allow for a little more flexibility with respect to isolation periods and using testing to sort of shorten that duration up. So I think that we're seeing a bit of reprieve now, but I would say through December and into January, that was certainly a challenge we were experiencing with ongoing exposure. So it's not necessarily that someone is in isolation for the duration of the outbreak. It's because there were so many cases that the exposures continued. So I think we're going to see some improvements on that front, and definitely some much needed improvements.
Thank you so much for that answer. My next question is for Rob and Melissa, also kind of talking about some long-term care residents. Right now in hospitals, are you noticing more long-term care residents requiring care for COVID-19 like we saw in previous waves?
I don't have, I can't quote you chapter and verse how many patients we have from long-term care at the moment. But what I will say is that across the pandemic, both St. Joe's and Hamilton Health Sciences have developed relationships with long-term care homes across the city. And those relationships have included the ability for long-term care facilities to call into our emergency departments and speak with physicians about particular residents, all with a view to trying to avoid admissions wherever possible. And so that process has been highly effective across the whole of the pandemic and continues through to this day, where long-term care facilities and hospitals have developed these relationships, which I expect ultimately will be long-lasting even after the pandemic. But I don't know, Melissa, anything to add?
I was going to say that's exactly right, Rob. And I wouldn't know the numbers either, but I would tell you that it's actually relatively low. And I think one of the success stories in this wave of the pandemic has actually been, I think, a credit to the long-term care facilities that they have been able to manage the outbreaks, manage the situation, manage residents in long-term care directly. And I think I think it is, probably connected to that partnership that we've all created and established with each other. But that is definitely a success factor this wave in comparison to what we experienced in other waves, for sure.
Great, thank you. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for the questions today. My first question is for both Melissa and Rob. Occupancy has been extremely high for a couple of weeks now, at 110%, over 120% in some of the hospitals, 104% in some of the ICUs. Even McMaster Children's Hospital has been sitting at 100%, which is very unusual. Where are you putting all of these patients, and how are you staffing these unfunded beds, considering, you still have high numbers of staff self-isolating and difficulties with staffing? So how are you managing this?
Do you want to start, Rob?
Okay, yeah, sure. I guess we're, the short answer, Joanna, is we're managing it as well as we can. Yeah, I think you're definitely highlighting the challenges that we have been seeing across the last number of weeks with these very high occupancy levels. I will say, we've done a lot in terms of hiring up staff in December and in January at HHS. I'm just going to look up the number. Yeah, we've onboarded about 450 new employees, so that has definitely been helpful. The other thing I would say is that the number of staff we have self-isolating at the moment is about 25% of what it was at its peak. But notwithstanding that, I have to say it's still been very challenging, and we try very hard not to have people in unconventional spots. And so we do have some beds that are unfunded, but it's still in conventional spots. And we've been able to create other spaces that, again, are not like having people in hallways across the whole of our hospital. Now, listen, it certainly happens, and particularly in the EDs when we are totally slammed. People do end up in unconventional spaces, but we try very hard to avoid it throughout the rest of the hospital to the extent possible. But the truth of the matter is just things have been less than ideal, Joanna, and we're very hopeful that we'll continue to see increases in staffing. We'll continue to see decreases in staff and exposure and infection rates, all of which are very helpful to getting through this very difficult situation. We've also, as you well know, had to transfer patients out, more particularly from critical care, in order to accommodate the extraordinary surge of patients we've been seeing.
I would say the situation at St. Joe's is very similar. What I would tell you is that we are trying our very best to keep patients in what's considered to be conventional spaces, but they're still not ideal spaces in comparison to what we would normally operate. And that's, true in the ICU. It would be true really across our whole bed platform at this point in time. It has been, and as you can appreciate, we are actively working on this each and every hour of every single day. And I know that's the same at HHS too. And if, your other question was about how we're staffing it, the way that we're staffing these surge spaces that we have moved into when we're above occupancy, right now, it's all through redeployed staff. So if we hadn't been redeploying, so we really needed that ramp down from a surgical and procedural perspective. This is why we also reduced the hours at our urgent care center. It was for us to pull these highly skilled resources into the ICU and onto our medical platform, our medicine platform too, at this point in time, and into the ED.
Thanks so much for being here to answer the questions. And my next one is also for both of you. Hamilton Health Sciences said last week that surgical activity is at 53% of pre-pandemic levels, despite needing to be at 75% to maintain access to urgent and emergent care. I'm looking to see if that is the same situation at St. Joseph's. And for HHS, what urgent and emergent surgeries are being postponed, and what effect does that have on patients?
Just for me to talk about the St. Joe's perspective, what I can tell you, I don't know what the numbers look like exactly last week. We could certainly get them for you too, Joanna, but today is the first day that we're actually at what we consider to be the threshold for us, which is 63%. So we're operating at 64% today, and hoping to maintain that over the coming weeks as well. But it has been a precarious situation too, certainly at both of the organizations. And in fact, to be honest with you, it's crossed Hamilton, Niagara, Haldeman, Brant, Burlington. So Rob, I don't know if you wanted to comment.
Yeah, I think we're, so I haven't seen the numbers today, Joanna, but I don't think we're far off of that 53% that you referred to. I think we are just barely meeting the requirements of performing urgent and emergent surgeries. But just to be clear, that the rest of those surgeries, the surgeries that are getting deferred, these are not cosmetic surgeries. These are very important procedures, and there's a real toll in human suffering, for the folks who are getting surgeries deferred, and we're beside ourselves at all of this, but we're doing what needs to be done. As Melissa said, we are using the staff that we've redeployed from those surgical ramp downs to provide care in other parts of the hospital. So we really have little choice. But as things start to get back to normal, we are very committed to doing all that we can to trying to get at this backlog of people in the community who've had to wait for these important procedures. Yeah, we are doing all that we can.
Great, thank you both. Our next question to Aura from CBC Hamilton. Aura, you can go ahead.
Thank you so much for taking my question. My question is for Michelle. I was wondering, could you tell us about the protests on Saturday and how they impacted vaccination clinics in the area?
Thanks, Aura. So on Saturday, with respect to our vaccine clinics, the primary care-led clinic at David Braley Health Science Center did close on Saturday, just as a precautionary step. The other vaccine clinics continued as usual, so the impact was quite limited.
Thank you. And I was also wondering, as we start to move away, I guess, from COVID as a pandemic and more towards the endemic, which I know we're still a little far from that, but can you tell us about the future of testing centers in Hamilton?
Is that question to me as well, Laura?
Yes, sorry.
Yes. Okay. No, that's okay. So very good question, and certainly not one that I have an answer for right now. I will say there's a lot being decided right now. We're still very much in a place, as you've heard from our healthcare partners, of dealing with Omicron and the impacts on the healthcare system right now, and certainly very much in a place where we're trying to manage current impacts. But as we move forward, and you'll know that the province is in a place that they're carrying forward with their reopening plan, there will be decisions made around where testing ultimately ends up, the role of vaccine, and what does our response look like. I don't know if either of the healthcare partners want to speak to the testing front.
No, I mean, I would agree with Michelle. We're not entirely sure where exactly testing is going to go, but we're certainly willing and committed to staying the course with providing the testing center that's currently on the mountain that St. Joe's operates at this point in time. There are priority groups that are still getting access to testing, and we want them to continue to get access to testing, but it's not entirely clear to any of us, I think, at this point in time, where exactly testing is going. So we'll continue to operate that clinic until that changes.
Great, thank you all. We have a bit more time for some more questions, so we'll go through again for one question for everyone. Nicole has left us, so we will go next to Joanna. Joanna, if you'd like another question, you can go ahead.
I always appreciate another question. Thanks so much. This question's for Michelle. Michelle, last week, the Chief Medical Officer of Health talked about just how important that third dose is, talking about how 2 doses isn't enough to really stop any transmission of Omicron, where with the third dose, you really do start to see a drop in transmission. So, we seem to, like everywhere across the province, see really significantly declining demand for vaccination. Can you talk about why we're seeing that and what more we can do to try and get people to get out there to get these third doses?
Thanks for that, Joanna. Lots of good messaging on that front. So with respect to vaccine uptake overall, you're absolutely right that we're seeing a delay, sort of a declining uptake, particularly among our mass vaccination clinics. And that's why we're starting to move back to that last mile strategy and look for opportunities to bring vaccine to places that's more easily accessible to people. So you'll know early on, maybe through our second dose work and even in the first dose work, certainly mass immunization clinics, large clinics like we had in hospitals, like we had at First Ontario, certainly very efficient ways to get people vaccinated, but those types of settings don't necessarily work for everyone. There's lots of reasons why other settings are more effective for some families in their community, in their neighborhood, through trusted partners. You'll see with the 5 to 11-year-old group right now that we are moving to a place where vaccine will be offered within school settings. So for those parents for whom it's difficult to get to a large clinic, childcare plays a role in that. People are working, so there's lots of reasons that it's difficult sometimes. And so providing vaccine during instructional period for some parents makes very good sense. And so that's an opportunity to increase uptake. We're also continuing with walk-in clinics, of course, so appointments aren't necessary, and continuing to message that. You'll see as well that vaccine continues to transition to other channels where both primary care and pharmacy in Hamilton have certainly stepped up to the plate and have been doing an amazing job of rolling out vaccine. And again, right in the community or in primary care where it's a provider that you trust. For some people, you know, the decision to get vaccine is one that they need to talk it through. They need to talk to someone that is a trusted provider, friend, colleague, or their healthcare practitioner. And so being able to provide those vaccines in different settings, although we might not see the throughput certainly that we see in those large scale clinics, those are the right opportunities and places for some people to receive vaccine. So yes, we're certainly seeing a decline in uptake, and that's why we're transitioning and continuing to, in fact, increase the number of clinics that are offered in other settings. So although they're smaller clinics, they might be clinics more suitable and basically amenable to what people need at this point in time. So we're certainly carrying on. We are absolutely encouraging third doses for anyone eligible, but if you haven't received a first or second dose, vaccine is a critical tool right now to really get us through this Omicron and get us back to a different place. And so definitely encouraging vaccine, whatever dose it might be, and looking for opportunities to see that happen.
Great, thank you, Michelle. We'll go back to Ara from CBC Hamilton. Ara, if you'd like another question, you can go ahead.
Yes, thank you so much. My question is again for Michelle. I was wondering if you think a vaccine passport should include all 3 doses now.
Thanks, Aura, for that question. I think that question is hard to answer on its own. Certainly, you know, like we just talked about, third doses are absolutely important. I think the place where we are right now, really, as we continue along this COVID journey, the spread of Omicron, of course, has been very difficult to control. And we've been trying, as you heard, to limit the virus transmission here in Hamilton. Now, though, we are in a place where we have safe and effective vaccines. You know that we've had significant uptake, great uptake across the city. We also, as Melissa noted, have a safe and effective, some treatments available as well. And we know through public health measures what we need to do to protect ourselves, to make those decisions for our families as we go forward. So government does have some decisions to make with respect to which of these public health measures will continue, whether it is vaccine passports, vaccine mandates, what public health measures stay, because ultimately it's going to be a balance that we do need to protect ourselves, of course, from COVID-19 and protect our healthcare system. But at the same time, like, what are those measures that are going to allow us to reopen? And as the province continues with the reopening plan, I think you'll see all of these different decisions coming to the table.
Great, thank you, Michelle. Mr. Mayor, that's the end of our media questions for today, so we'll pass things back to you. Okay,
thank you, Jasmine, and thanks to all of the folks that have presented their information today. Rob MacIsaac at Hamilton Health Sciences, and Melissa Farrell at St. Joe's, and of course Michelle and Jason, thank you all for that important information. Thanks to the media partners and to Bill Custers and the Cable 14 and Clear Cable team for pulling these together, and 100 and whatever it is now. Bill, you'll let me know. And if you need any additional information on COVID-19 financial supports or any of the updates, visit our website at hamilton.ca/coronavirus. And yeah, please continue to follow all the public health measures and get your vaccine. Third doses are important. And so, you know, the more that people realize that this is going to be an important part of preventing serious illness or ending up in hospital, and we know that the hospitals continue to have ongoing challenges to provide the care that they want to provide and will provide, but you know, the challenges are very much still there. And so the vaccine is still the best path forward in terms of fighting against this virus and not getting seriously ill. So if you haven't had your first or second dose, please do so. The availability is all there. You make an appointment, or walk-in clinics are still available, and that third dose is all important as well. Thanks for everything today. We will see you next time on Tuesday, February the 22nd at 4 p.m. For our next media briefing on this. And in the meantime, stay well, stay happy, stay healthy, and have a good week.